Hello, I'm here at Kaiser Permanente. We're all hooked up right here to Yervoy, getting ready to try this new experimental drug that's been approved by the FDA back in April 2011, and just waiting to get the medication. And I'm going to be letting all of you know how it goes with me, because if this works, it can be beneficial to all of us. So I'm hoping that it will do good for all of us. So I'll let you know how it goes. Hello everybody. Well, I had my Yervoy treatment. That was back on October 25th. And actually, amazingly, everything went really easily, really well. I had no side effects. I was waiting for anything to happen, but nothing. It was as if I never had any treatment. So I'm going to go in again on November the 16th, and we will see if there is any changes then. Had a PET scan. It looks like there's a few things that advanced a little bit on my thigh, and also hello everybody. My batteries went out, so I'm re-recording this. Anyway, so the doctor told me that my last PET scan was a little bit advanced, so that means that there was some spots on my liver. The dome of my liver is how they put it. There was uptake in the kidneys, which is she described that as something that it's because that's where you excrete your liquid out of your body, so that's not unusual. She said we did expect it to advance a little bit more, and sometimes with the Yervoy apparently it might get worse before it gets better, and then it starts healing itself. So she said we are hoping that it's going to make everything disappear. So I hope that's the case, and I will let you know. Keep a positive attitude, everybody, because you know this is what the main thing is about, is keeping a good outlook and hoping for the best. And if this works for me, it's going to work for you too. So hang in there, and I will tell you what happens next. And my next appointment is November 16th, which is Wednesday, a couple weeks from now. Okay, thank you. Take care. Bye-bye. Hello everybody, it's Lisa. It's been a while since we've talked. I just wanted to let you know what's been going on lately. I had a couple of side effects, which I hadn't had any this whole time, but now I've noticed some things going on. So December 7th, I had really bad problems with migraines, and my eye felt like it was swelling up, felt like I had a hot poker in it or something. So I ended up having a brain scan, and they got me in right away, thank goodness, because there was another patient who was having the same problems, but they waited on him. And so I went ahead and went in, and turned out my pituitary gland was swollen up. It's one of the 2% people that have this problem with this particular drug. So if you have that problem, tell them immediately. And it was also pressing down on my optic nerve on my left eye, so it felt just like a really stinging sensation and swollen and everything. I would put ice on it and that would help. Then the other thing that I've noticed, I had another treatment, and so that was my third treatment, and then I noticed a lot of fatigue, and I noticed that I was getting, it felt like my intestines were swelling up, which is part of, you know, some of the side effects that they talk about as well. So I was like fluctuating between, you know, just having a really hard time with that. And then I couldn't take it anymore, so I decided that I was going to go in and get, or insist on a CT scan, which I was having trouble getting in right away. So I just went to emergency and had that done yesterday. So yesterday was January 19th. I was supposed to have my my treatment on my fourth treatment on January 16th, but they put it off because of this problem. So I said I need to get in there now, because I only have until about February 5th to finish up these 4 treatments altogether. So I've had 3. Anyway, so the CT scan showed that I have a liquid inside my abdomen, like all the way up to here and then all the way down to my pelvic bone, which was giving me a lot of discomfort. I couldn't figure out why it's pressing down on my lungs and everything. But it might have something to do with my liver, because that happens when you have liver problems. So we're just waiting to see. The doctor's going to compare the CT scans, the PET scan and the CT scan, to see what the difference is, and he'll get back to me hopefully on Monday. So that's what I've been going through. So lately it's been a little hard to find things to eat. So I'm eating like yogurt, and I'm eating just things that won't cause any gastritis problems or anything like that. Just trying to take it as, you know, easy as possible, because stress causes a lot of problems too. So I hope I can get my 4th treatment in. She said, my nurse said that I might not be able to because of the side effects, but maybe it's already, you know, done its job, and I don't need the 4th treatment. It's wishful thinking. So anyway, I hope you're all doing well. I hope you're all feeling okay, and I will let you know what goes on. All right, and Happy New Year. It's 2012. Take care. Bye. I almost forgot to show you, but I wanted to let you know, just in case you're dealing with the same thing. This is what happened after they did the surgery, okay, for me. This is what popped up on my leg, okay? I think you should see it just in case you're going through the same thing, and I'll show you now. See? So it's these little lesions that popped up here, okay? This is my thigh. And the original incision was this here, right there. It was just a mole. Now I've got another bump right here, and I feel one developing right on top here too. But this is what it looks like. So people weren't aware of that, so I think you should know. And it actually looks like it's clearing up. It actually does look like it's clearing up. And I was told that there was another patient who had the same thing. Unfortunately, it was on his face, but they said that they thought that, you know, he was finished, you know, like through. But he ended up coming back in about 6 months later, and it was all cleared up, and he was really well. So there's hope. You got to keep hope, okay? All right. Take care. Keep your fingers crossed. Everything's going to be fine. Take care. Talk to you soon. Bye-bye.